Hi, I'm John Hines, and I'm happy to be back with Blue Cross and Blue Shield of Minnesota to talk about the health and well-being of many in my age group, being seniors 65 and over. A year ago, we gathered via Zoom and talked about what was on many people's minds in 2021, the pandemic. The vaccine was just becoming available last year, and many folks were still having to avoid a return to normalcy. I even skipped the Minnesota State Fair. I'm excited to share that Blue Cross Blue Shield recently conducted another survey to find out what's on people's minds in 2022 and how their attitudes have changed from previous years. This survey was conducted this past July, and it revealed that many are feeling much more confident after pandemic restrictions have eased and vaccinations have been distributed. This has led to nearly double the number of seniors feeling more in control of their health as compared to last year. As a matter of fact, nearly 2/3 of those surveyed made changes to their living arrangements, going so far as doing things at home to prevent falls. And there was an overall increase in the number of Minnesota seniors feeling like they have things to look forward to. To add to this, most are excited for travel, with a majority surveyed indicating that they plan to travel in the next year, with over 80% of those travelers saying that they plan to travel more than once. It makes sense, as many have already made trips to see the people that they missed since the pandemic started. I personally had a chance to travel to Alaska very recently, making plans now to go and visit my son in Ireland. Though the results of this survey show that people are feeling overall more confident, I wanted to bring in Dr. Mark Steffen, the Chief Medical Officer at Blue Cross and Blue Shield of Minnesota, and ask him for his perspective on a few questions related to health and travel. And Dr. Steffen, I can't tell you how nice it is to have you back in a face-to-face setting, since what we had done previously was all done virtually. But there are some questions that come with the survey, some things that people want to know, and I thought this would be a good time to run some of these things by you and maybe even help us all individually establish some guidelines.
Yeah, no, it's great, John. It's great to be with you, and much like you, it's really exciting to be back in person.
Well, good. I hope so. Thank you very much. Hey, one of the questions that came up, and of course we know that regular exercise is essential for good health, but it can be difficult, though, to stay in a routine, especially with the link to traveling while we're away from home. What's your advice for people who want to stay physically active while they're out and about and traveling and on the road?
Yeah, it's a great question, John. I do a fair bit of traveling myself, and fortunately it can be easy as just bringing your tennis shoes with you. We live in a great state, so if you're traveling throughout Minnesota, you can get outdoors, put on those tennis shoes, and get a great walk in. You also need to remember, like when I go to hotels, there's fitness centers, there's pools that are available to me, and they might not be things that I regularly engage with when I'm at home, but it's an opportunity to try something new when I'm out and traveling.
Okay, here's something that came up for me personally, and hopefully I'm relating to a good many others at the same time. But when traveling, you might have an ache or a pain or something like that. When should we attend to something that is nagging us? Is it before we travel, after we travel? I recently had a knee replaced, and it was the best thing I ever did. But I mean, that's sort of an extreme. But when would you recommend that people tend to these aches and pains, before traveling or after?
Yeah, and some of this depends on the duration. So, John, you're talking about headed to Ireland to go visit your son. Big time travel, right? This is a big commitment. You're going to be there for a while. You're going to be out of the country. Probably a good idea to go in and get something checked out if that's what's going on. Now, if you're taking a short weekend trip, that's a different consideration. A lot of times the best advice is just talk with your doctor. They can help advise you. If you're going to require a surgery or some kind of procedure and you're having a trip that's coming up, they can help talk you through, boy, should I do this before, or is this something that can wait until after?
Okay, that's good advice. Well, obviously it's good advice. That's why you're here. On the other hand, a lot of seniors do have, same as I do, routine checkups like their annual wellness visits, which could overlap with travels. How should we handle these routine appointments? Step them up, move them back, set them aside? What's the plan?
Yeah, I think it's always a great idea to ensure that you're getting those in. So I think the biggest thing is that you don't want to sit and wait too long. It's always easy easy to procrastinate. So, if the time is now and it's been, that year since you've had your last one, go in, get it done.
Okay, here's one I found really interesting from the survey, and this kind of caught my eye right away. About 2 in 3 Minnesota seniors feel that having access to medical care or to prescription medications is extremely important when we are away from home. Yet only 1 in 5 have actually had to use it. It's kind of a peace of mind thing, I think. It's kind of like better to have it and not need it than to need it and not have it. But for seniors planning to take long trips that might be, it involves some time, considerable time away, what might be useful for them to know about accessing their health care and prescription medications while they are out away from home and on the road?
Yeah, it's a great question, John. And I think the great thing about Blue Cross plans is that we really provide this broad network that's nationwide. So no matter what state you're traveling to, you are going to have access to providers in that state, to pharmacies in that state, should you need care. And I also think it's important to remember there's virtual options available to people as well. And those virtual options could connect you back to your primary care physicians in Minnesota, or it could connect you to other providers across the country. So the most important thing is that there's a variety of options. I just want to make sure that people understand those options are available to them and ready to access.
Dr. Steffen, here's another thing I found interesting from the survey that Blue Cross just did. 4 out of 5 seniors said that their mental health is just as important as their physical health. I think one leads to the other. Are there ways that folks can work to improve both of these?
Yeah, and so there is a deep link between physical exercise and people's mental health. And we know that physical exercise can improve our mental health overall. And there's some additional things. So, exercise programs like yoga or Tai Chi have really been shown not only to have benefits for our mental health and our mindfulness that we have, but to our physical health, including things like even lowering your blood pressure. So there's ways to engage in exercise that we know are going to have positive impacts on mental health. And I'd be remiss not to mention, we know that engaging in green spaces, so getting outdoors, and particularly those that aren't paved over, can have benefits for our mental health.
I was just thinking about that because oftentimes when you see that vista or something like that, it's just sort of a kind of a decompress that goes with it.
Yeah,
right?
Listen, if you're sitting in Minnesota overlooking green scenery and you see a sunset or a sunrise, nothing better in the world.
All right. Let's talk about this too, because talking about traveling and how it relates to mental health, you know as well as I do that with the way traveling has changed, going through airports, things like that, the restrictions that come with it, it can be kind of stressful in a situation like that. Offering suggestions, can you offer some suggestions for us to find some mental health resources while we might be away from home?
Yeah. So, one of the great things that came out of the pandemic was increasing access to virtual care. So we saw a huge uptick in people accessing providers via video chat or even by the phone. And that's continued throughout the pandemic, and that includes to mental health providers. So I think it's important to ask the people that you see, both for your mental health as well as for your physical health, are there telehealth options that are available to me? At Blue Cross, we offer these telehealth and virtual options widely, and we have a lot of providers that are engaging in those. So that's one great way. The other ways are more simple practices. So, one I like to think about is mindfulness. And we've seen more seniors and more people at all ages engaging in some of these mindfulness practices. And that's a combination of really taking a step back and being in the moment. And it usually combines some breathing techniques. And we know that those can really help reduce stress. And like I said before, they can even help reduce some of the physical health symptoms that we have and have been shown to have some benefits on people's physical health.
All right, good. I want to come back and touch on mindfulness and meditation, as you mentioned earlier, things of that nature. But I want to ask about this. In the survey, many seniors are planning road trips, with over 70% reporting that they'll be driving their own vehicles. I mean, I prefer that because then I get to stop when I want to. What do you recommend to ease discomfort related to sitting in a car for for a long period of time.
Yeah, well, you just said it, right? You're going to stop when you want to. And so I think the important thing is that if you're going to be driving for long distances, plan out those breaks. And if you have to take a couple extra, so be it. Enjoy the ride, enjoy the scenery, and get out of the car. Take some stretch breaks. Walk around. If you're traveling through Minnesota, we have fantastic rest stops and beautiful areas that we can access and spend some time in. So I think that's the most important thing. For people with some conditions like blood clots or other things, it can be really important to do that even more frequently. And I encourage those people to go talk to their doctor as they're going on some of these longer trips.
All right. When we're out of town, whether it's across the state or across the country or in another country for that matter, routines can get turned upside down. I'm guilty of this all the time. What's some advice for remembering some helpful things like taking our medication at the right time on the right basis and doing this the way we should be doing it?
And some of that mix up of the routine is great, right? We're on vacation. We don't need it to be the same day that we live every other day. But it is important to keep some of those routines, especially related to medications or things that you do for your own physical and or mental health. Pill organizers are a great way to do this. So if you're taking medications on a regular basis, the pill boxes that they have that split out the medications by every day of the week can be a great way to hold yourself accountable and make sure you remember, boy, did I take that medication this morning? And when that box is empty, sure enough, I did it.
Yeah.
So that's one great way. The other access to technology that I think is important is the smartphones that many of us carry around, right? So setting alarms and reminders, that reminder comes up, oh, time to take my medication. And so those are a couple great ways that I think people can remember to stay in those routines that are most important to their health.
Okay, very good. Dining out, I was just thinking about this. Dining out with family and friends is tops on the list for the majority of those people that were surveyed. Even when you're traveling, because somebody says, oh, you're going to be in town, let's get together for dinner or whatever. But roughly the same amount of people, was 66% versus like 62%, said that they still want to prioritize eating healthy. How do we do both? How do we have a fun time dining out with friends, yet keeping to our regimen of living healthy?
Yeah, so much like the survey responded, I think restaurants are hearing this, and we're seeing more and more healthy options be added to menus all over. And on top of that, they're actually adding in the nutrition information. So oftentimes you can look at the menu and they'll display some of the nutrition information. How much fat is in this? How much sugar is in this? And that can help you make informed choices. The other thing that's important to me, and I do frequently, is ask the restaurant to specialize something on their menu. So rather than maybe a sautéed vegetable that's in butter, I'll ask them, hey, can you steam those vegetables for me? Or convert something that's supposed to be fried and ask it to be baked for you. So don't be afraid to ask. Look at the options available to you, and remember too that everything in moderation, including moderation. So sometimes people get to enjoy themselves, and that's okay.
Okay, good. All right. Hey, COVID-19 restrictions have eased somewhat, but there's still a great concern about a resurgence. What's a good way for people to stay informed? Because it seems like there is new news or new guidelines. What's a great way to stay informed on a day-to-day basis while we're traveling?
My first stop is always the CDC, particularly if you're talking about looking at sort of national recommendations. And they've included a lot of information on those websites, even to how much community spread is going on in every county in the country. So if you go to the CDC's website, you can go to the county that you're going to be visiting and look at, boy, how much spread of COVID is going on in those counties. And then you can make some choices. Maybe I'll choose to mask up when I'm indoors or avoid some of these large gatherings. So that's one great way. Any of the state health department websites usually have good information. So the Minnesota Department of Health is a wealth of information on the topic, and the other place that I really access frequently.
Okay, good. Whether we are at home or traveling, There are some things that seniors can do on a regular basis to stay physically and mentally healthy, especially as we come into the fall season here. This is where I ask you, Dr. Steffen, for some sort of a recap on some of these things, so, sort of a general overview, just to take away with us.
Yeah, that's great, John. So, I think in terms of physical health, there's a lot of things we can do to get out and get fit. At Blue Cross, we do offer resources, including Silver Sneakers. So if folks have not participated in Silver Sneakers, you should really go check that out. It's a fantastic option that can help you stay fit. Let's talk back to the mindfulness. I think that this is a really important and often overlooked opportunity for people that, like I said, it only takes 10 to 20 minutes a day. So if you don't know a lot about mindfulness, take this opportunity to go look at it, read about it, and see if it's something that fits into your lifestyle, because it really can support your health.
Okay.
And then just the last piece, as we think about COVID and we think about our upcoming flu season, vaccines still remain important. So make sure you're looking at when are you due for your vaccines. Get the boosters that you need, and the flu season is right around the corner, so if you haven't had the opportunity, go out and get that flu shot.
I can't thank you enough for the opportunity to visit, talk about this survey that was recently done. Dr. Mark Steffen, the Chief Medical Officer for Blue Cross Blue Shield of Minnesota. Thanks, Dr. Steffen. The survey had a great deal of information and perspectives from seniors on their travel plans and concerns and health goals. So if you want more details and insights from seniors, I have written a blog which can be found at bluecrossmn.com/seniors. Thanks for watching. Stay healthy and stay safe, and we'll see you next time.